Well, it's 7:48. Welcome back to the Mountain Morning Show. My name is Dane Craig, and you know, living in such a beautiful place, many times we get out, of course, and do hiking and skiing and biking, and sometimes get a little over our heads in our ability, or maybe we just need to do something to get prepared for this. This is why we have our guest in studio right now from Mountaintop Physical Therapy. We've got Jason Ball is here, and Jason Bell. Jason Ball is one of our directors that's on vacation. And Preston Hall is here. Guys, welcome to the program. And you've got a lot to talk about this morning because there's so many of us that do get out there and sometimes injure ourselves. And you have a different approach to things. You kind of integrate kind of a team approach to how you can help people with their exercise and conditioning, right?
Yes, Dane, thanks for having us on, and we're excited to talk about what we do here at Mountaintop Physical Therapy. We're located within the Silver Mountain Sports Clubs in both ends of town, so we have access to utilize all of those facilities with our patients. And we're also, we have a team of professionals that can provide the full range of services from physical therapy, rehab, all the way up to the highest level of performance training. And that's a lot of what Jason's going to talk about today. What I do is the physical therapy end of things, a lot of evaluations, designing treatment programs, and then when a patient gets to a certain stage where they're ready for the next level, we transition over and let Jason take over at that point.
And what do you do at that point, Jason?
For me right now, so the later stages of rehab, I'm taking whoever it is, client, athlete, we're taking them back to that next level in what they're doing, and I do all the transitional rehab stuff, designing programs to get them back to doing exactly what they do, whether that's ADLs or out riding on the hills, whatever. We're getting them involved and getting them fully ready to go back and do what they do. So
now let's talk a little bit about maybe some of the weekend warriors. I mean, guys like many of us, you know, you work a 5-day-a-week job and you want to go out and do something, but maybe during the week you don't have enough time to condition. What are some of the tricks? What are some of the things you can tell the guys and the gals, of course, that go out and they want to hit biking really hard? It's just starting to dry out there, so the trails are starting to become more available. But a lot of injuries happen when you're not ready to put that kind of stress on your body. So what do you suggest as professionals in the sports medicine industry to make sure we don't get injured, or maybe we can do this a little bit smarter, a little more healthy?
Okay. With going out and doing activities, we believe that there's a level of preparation. It's a big part of what we do is preventative. Okay, prevention we think should be first. There's a huge push right now on even performance enhancement, strength and conditioning. But right now, the belief is that we want to build a strong foundation, and we do that through going and doing an assessment, evaluations. Again, going back to kind of the team approach, and by having a true understanding of where that person is, what their underlying weaknesses are, postural distortions, things like that that may predispose a person to injury. We believe that by starting out by doing an assessment, we can truly individualize and make a good program. So
you really kind of analyze the client to make sure that, like you said, there may be some alignment problems, maybe just things you were born with that you weren't aware that you might can't one way or the other as you're exercising, and to be aware of that, which could approach, you know, maybe a better, I guess, direction of how you run, for example, or to understand if you're going to be lifting weights or doing something that's a little more stationary. You know, one of the things that you guys bring to the table that I think is very interesting, you have a lot of education, a lot of experience. Speak to that just a little bit, because I think this does set you apart from some of the other physical therapists that are out there.
Well,
I mean, you've got a doctorate, right?
Yeah, I've finished a doctorate degree in physical therapy, which is currently the standard of the physical therapy schools. They've all transitioned from a master's degree over the last decade or so, and a lot of the students coming out now are receiving doctorate degree in physical therapy, and then some therapists like myself who've been practicing. I've been out for about 14 years. I was able to go back and kind of upgrade my degree from the master's to the doctorate degree. And then Jason has a master's degree in rehabilitation science as well, which ties in really well with the physical therapist. And he really thinks on our level, and we integrate seamlessly, transitioning these patients from you know, whatever level of debility that they're in, finding out what their goals are, and then helping them achieve that highest level of function.
And you also work closely with orthopedists in the area, so doctors will refer their patients to you as well, but you also take on private clients as well, correct?
Right. I would say that the doctor referrals is about 70% probably of our business, orthopedists, family practice. Certainly the word of mouth, people are able to come to physical therapy directly. Utah's considered a direct access state, meaning people can come to us without a physician referral, and probably 80% of insurances allow them to access their physical therapy benefits without a doctor's referral.
Okay.
However, we do love to integrate with the doctors, get their feedback, collaborate with them so they see our perspective on that patient, and keep that communication going.
Now, with your integrated approach, do you also touch on a little bit, besides just the healthy movements and movement patterns, do you touch on healthy lifestyle with your clients as well, as far as diet, sleep?
I'll let Jason talk about that because that's something he's very good at, is tying all those other aspects.
What are
in.
some of the trends you're starting to see? Is there something that you're seeing in some of your clients that you'd like to see change, that you seem to be speaking to a lot with your clients?
Yeah, I think in this town there's a lot of potential for overuse injuries, for starters. A lot of, let's put it this way, there's not a lack of motivation to go out and go do things.
Okay.
In this town, there's the whole continuum of biking, skiing, cross-country skiing. If anything, there's the possibility of overdoing it, if anything else.
Makes sense.
Again, if we go back and individualize, get an assessment, have an understanding of where you are, so before you go out and go do what you're doing, you know some things that you may need to work on, whether that's core strengthening or mobility issues or whatever. And but so recovery regeneration would be another area that I think that athletes need to have a better understanding. Recreational athletes, we got a lot of high-level athletes in this town too. That to be able to go out, do what you need to do, but make sure that you're recovering. So talking about sleep with them, providing with opportunities, whether that's massage therapy, active release technique. Contrast showers, teaching them things that they can do to help enhance their recovery to be able to come back and give a good effort again the next time. I think over time, if a person ends up getting really fatigued, they come back, one, the performance is not that great, and then two, they have a tendency to get injured as they get more fatigued.
So what you're saying then is that you actually put together, you design a program based on whatever their needs are for, in this case, rehabilitation, recovery, to get back to that performance level, but you can customize exactly what they need for their particular injury to recover from, or maybe the performance they're trying to approach.
Absolutely, and I think the future of strength and conditioning and physical therapy and everything else is an idea of an integrated team approach. The more that we can get different components involved, we're going to have a different eye on the situation and be able to truly provide great programming. And great programming is a part of a prevention program to begin with, because if we can educate and empower that person about underlying weaknesses and balances, they're going to flourish in what they do. So.
All right. Jason Bell, thanks for being here with us. And Preston Hall, guys can be contacted at Mountaintop Physical Therapy. Do you have a website?
It's parkcitypt.com.
All right.
That is under construction a little bit. It's functional, but is going to be enhanced very soon. Or call us at 647-WELL.
Very good.
W-E-L-L.
All right, thanks guys for being with us this morning. Mountain Morning Show will be right back. We're going to have your answer to your trivia, and we'll wrap things up. Coming up next on the Mountain Morning Show.